I'm Dr. Kelly Colleen. I'm a plastic surgeon in Beverly Hills, and I specialize in breast surgery. Let's talk quickly about 5 things I think every woman should ask their plastic surgeon when they're considering a breast augmentation. So the first thing I think you should ask is, where is the incision going to be and how big is it going to be? There's really 3 standard incisions for breast augmentations: in the armpit, underneath the nipple, and underneath the breast. It's really important that your plastic surgeon discusses with you which one of these incisions makes sense for what you want and the type of augmentations you're going to get. There's different pros and cons to the different incisions. It's also important to talk about how large the incision is going to be. Although there's a lot of surgeons that show you really tiny little incisions on social media, the truth is that if the incision's too small, the implant is more easily broken on the way in. I promise, guys, it's worth it to have a tiny bit longer incision so your implant gets in there safely. The second thing I think you need to ask is, what type of implant is the surgeon recommending? And this includes saline, silicone, and the profile: high profile, low profile, moderate profile. These are really important things to know. You want to make sure your surgeon doesn't have a one-size-fits-all philosophy with breast augmentations. There's different implants for different people, for different breast shapes, and for different outcomes. And so it's really important to understand why they're recommending the implant they're recommending and what they expect it's going to do for you. The third thing to ask is whether the implant is going to go under or over the muscle. So under and over the muscle breast augmentations can both be beautiful and have gorgeous results long term that cause the patient no trouble and have minimal complications. The key is figuring out which one of these things is best for you. So for most patients in my practice these days, over the muscle is how I do augmentations. I used to do them mostly under the muscle. Like I said, pros and cons to each. You need to talk to your surgeon and find out why they recommend what they recommend. The fourth thing that you really need to talk about with your surgeon, and many people forget this one, is what does your surgeon do in the operating room to minimize the chance of implant complications? Implant complications can be devastating. They can be expensive and they're heartbreaking. And I'm talking about things like infection, incision healing poorly, capsular contracture. All of these things are terrible. There's things that we can do in the operating room as surgeons to minimize your risk. Some of them are simple, some are more complicated. Just covering the nipple with a tegaderm or a plastic coating can reduce your infection and contracture rate. You should be at this point using a Keller funnel or a sterile funnel to place your implants to minimize the chance bacteria gets on the implant on the way into your body. So these are important questions to ask. Some of these things cost a little bit more money, but they're important to do to prevent problems. The last thing you need to ask, and I think this is the most important thing I tell patients to ask their doctor, is how do I maintain these implants? Breast implants are not lifetime devices. They are not going to be there forever, and you need to know as a patient what the maintenance is going to be. Your surgeon should be clear with you. Do you need imaging when you need it, and how to get on a schedule? You should have an idea of what these types of imaging studies cost and where you can go to get them. Your surgeon also should discuss with you whether or not they recommend your particular type of implant is switched out at a certain point to prevent rupture-related complications. Every time you go into surgery, you need to know not only the beautiful results that you're going to have, but what does this look like long term to prevent complications and keep that result looking good for the rest of your life. So that's my 5 things you should ask for a plastic surgery consultation for a breast augmentation. Let me know if you have any questions.